in healthcare, transforming diagnosis, treatment, and access. The panelists are Dr. Brett Lyndall Singh, CEO, AOM, Alpha and Omega Group; Dr. Gail Urey, Honorary Lecturer, the Steve Biko Center for Bioethics, Wits Medical School, and the CEO of the Johannesburg Coronation Foundation. The moderator is Palesa Mufokeng, CNBC Africa presenter and producer. Some of the biggest challenges facing the healthcare system in the African continent are access to healthcare, shortage of hospitals, medication, health workers, resources, inefficient government systems, infrastructure, among others. Artificial intelligence is rapidly becoming one of the most transformative forces in modern medicine. From AI-powered diagnostics to mobile health tools and virtual consultations, we are witnessing a revolution in how care is delivered, accessed, and experienced. AI's ability for early diagnosis, like identifying early signs of cancer, cardiovascular disease, and neurological disorders, assisting in offering new hope for prevention and timely treatment. AI tools are helping bridge the gap between rural and city communities. From over-the-phone or video consultations, AI is extending the reach of scarce medical expertise, providing life-saving insights to areas where specialists may not be available. This could be a game changer for the previously disadvantaged and a critical step toward achieving universal health coverage in Africa. With this healthcare innovation, it is important that continental governments ensure the technology is safe, inclusive, speaks the languages of the people, and overall tailor-made for the people it is meant to serve.
Okay, we're going to jump right into it. Now, we do know that artificial intelligence is rapidly transforming so many aspects of our lives, but in the healthcare system, it has been quite described often as the ultimate game changer. If I can start with you, Dr. Singh, what is the most significant or meaningful contribution that you see in AI in your work?
Thank you so much, Palesa, for your question. I'd like to first set the stage. In South Africa alone, in public health, we spend almost 300 billion rands every year to capacitate our public health centers. And out of that, 130 billion rand goes to district hospitals. These are hospitals that are in far-flung rural spaces. I'm currently based in a hospital in Ehlanzeni district in Mpumalanga called Matibidi Hospital. And to give you context, the closest shopping center is 50 kilometers from the hospital. So it's extremely rural. And as practitioners and healthcare providers, we are seeing AI being used in helping capacitate your junior doctors and doctors who don't have experience of maybe less than 5 years to have the access of a specialist type of experience in your pocket through your cell phone or through a referral with one of the specialists in your district. So I think that that AI has a huge role to play in healthcare. However, we need to have more access to data that we are getting from our patients. In public healthcare alone, the majority of our hospitals still use paper and pens to conduct histories and progress notes for most patients, as well as scripts, for medication. And a lot of this can get lost in the system, due to filing errors, or a lot of it can just not be easily accessible. And also, you can't really translate information that's written on a piece of paper very easily when you're trying to use some of these tools. So I think that from a base stage, most of our areas that are accessing, that are giving access to the majority of our population, need to first digitize the system, where you have health informatics and a basic data of patients being recorded digitally, and that is going to be able to help you to have an access to more data, in things like radiology and dermatology and pathology, for example. Those are 3 sectors in medicine that AI is already rapidly evolving because we've identified certain criteria as well as markers and points to see when certain tests or certain results are out of the norm. So I think there's a lot of space for AI to develop, but we need to first digitize, we need to first give access to internet connectivity. The average public hospital in South Africa doesn't have an internet connection. And so how are we going to actually, have access to these AI tools if your healthcare providers aren't able to do that? And of course, everybody's looking at how is AI going to steal, a doctor's or a healthcare provider's job. So I think that's also another issue, as we have almost 2,000 unemployed medical doctors in South Africa and thousands of other allied healthcare practitioners. I think we just need to distinguish between using AI to remove sort of guesswork in medicine and helping to sort of give concrete evidence-based diagnosis that has peer review research behind it, and also bringing that access to maybe a doctor who doesn't have access to a specialist or specialized testing in their current facility.
Yeah, you've given us such a thorough overview there, and we'll get into unpack the challenges that you've outlined. But I saw you nodding there, Dr. Ear. If you can just share your sentiments towards AI and its contribution to how you do your work.
All right, I think the most important thing that we have to understand about AI in the healthcare sector is that I've listened to previous speakers, and when we talk about optimizing workflows and making jobs and workflow easier, that's one thing. When we talk about healthcare, we're talking about the man on the ground that needs to have some kind of care. And what Dr. Singh has explained is that we need to be able to provide this, and AI would be an awesome way of doing it. But in healthcare, the most important thing for us is that we're doing something to another human. And human beings need to understand, they need to trust the technology that you're using, they need to know what you're going to do, and AI is very, very far away from that yet. We don't have access to it in pretty much all of our centers. And our population, and we live in Africa, we need to understand that even in our centers, we don't have computers. So when we start speaking to someone in a rural area, for example, who needs to have some kind of diagnostics done, and we're going to use this big machine, how do we explain this to the patient so that they understand, so that they can give an informed consent? And in healthcare, informed consent is the absolute basis of everything that we do. So I feel that Dr. Singh's actually put it very much into perspective. It's a tool that we really, really could use. We really have to go back 50,000 steps and start with how do we talk to our patients and improve health literacy first.
Now, some of the research that I found was that one of the key barriers that are preventing AI integration and scaling in the country is AI bias, right? And it's something that Dr. Singh also just touched on, and this is largely stems from insufficient data that reflects the country's diverse population. Do you think we can get to a point where AI and the healthcare system can serve all South Africans equitably?
Oh, that's an awful question. Yes, in 2039, maybe 45. I think the most important thing for us, and in South Africa we do have a problem, is that we have AI bias. And if we use, for example, international data, their data isn't African data. We've got disorders here and diseases here that they don't have overseas and they don't see. It would be so important for Africa to be able to pull together, and I say Africa as a continent, to be able to pull together to make sure that we get that data together and we take out. AI, remember, is a tool, and it's always been used to manage healthcare. And we've always worried about cost and utilization. What we need to do now is take that out of the equation and look at just exactly what our outcome needs to be. And by doing that, the bias goes, because at the moment we're using old data, and remember, most of it's funder data, and there's a lot of bias.
Sure. Dr. Singh, if I can just come back to you, your company played a critical role in South Africa's response to the COVID-19 pandemic, and now you're leading initiatives in the healthcare product localization. Now, against this backdrop, what role do you see AI playing in strengthening national healthcare systems?
Thank you, Palesa, for that. I would just like to ask the audience, the last time you saw your GP or your doctor, you went into their consulting room, you sat down, and then you went straight into your problem. The doctor would ask you, how can I help you today? And then you would say, I've been having some backache for, say, 2 weeks. And then we would just continue to take a history from there and possibly give you a script of some analgesics for you to go and take from the pharmacy. I was trained in the People's Republic of China, and I was based there for over 10 years, and I was part of the anti-pandemic task force in the initial COVID response in China. Some of the experience that I gleaned from there was that their way of diagnostics, and in large, the Asian model of diagnostics, is to have a barrage of vital signs and diagnostic tests to be done before you see your general practitioner. So in South Africa, or in Africa, we would go and see a GP, we would sit down and we'd talk about our issue, a history would be taken, and then they would prescribe certain tests for us to do. Maybe it's a chest x-ray, or we'd go and take a couple of vials of blood for us to see how our blood chemistry is, or our full blood count, etc. But if you have access to a generalized diagnostic model, or a physical exam center where you can have a barrage of ultrasound and blood test as well as chest x-ray, just as at a base level, and you'd be doing that annually, you'd be able to already start to generate that data that Dr. Gale is talking about. And so in South Africa and in Africa, we are really experts in healthcare providing in certain diseases like in HIV and TB burdens. I'm not too sure if you know the current literature, but the mortality rate for an HIV diagnosed patient is actually excellent if they start their treatment early, and if they continued to have regular checkups for us to monitor their viral load and their immune system. So I think that if we can sort of standardize a diagnostic systems where we have a figure of how much it costs the state or how much it costs an individual just to do a barrage of simple diagnostic tests, and there you need investment in the infrastructure, and you'd also need to sort of capture that information in a way that's transferable and that could be, as some of the previous speakers in our first panel talking about analytics of that data, then you'd be able to crunch out better outcomes. You'd also be able to feed that into better machine learning engines, and you'd also be able to help to sort of tailor make certain therapies that are going to help them. But again, as Dr. Gale is saying, you have to be able to share what you're trying to do with your patient by informed consent, by actually telling them that, hey, I would like to take these tests so that I can help you, to give you a better outcome, etc. So I think communication is an issue. And, we have 11 languages in South Africa. You have doctors that are sent across the country. Maybe I'm learning Spedi and Sutu in Mpumalanga. But if you go to KwaZulu-Natal, you need to be able to speak Zulu. So I think those things are where AI can also help with in terms of, simple translation, as well as simple capturing of that information. The first panel spoke about meeting minutes, right? You'll be able to capture a voice note and then run that through that. I'm sure all of us is using that technology to transcribe those notes. Now, can you also transcribe your consult with your patient? Or you as a patient, can you also record that consult? And then say, hey, I'd like to record this so that I can have access to this for myself. So I think those are all the questions that we need to ask ourselves and continue to bring access to digitizing some of that information. Yeah.
Now, there's this big accountability question that if a patient is harmed due to an AI recommendation that did to the doctor, who then takes accountability? Is it the doctor? Is it the clinical center? Dr. Yeah, you're smiling. I'm going to pose this one to you.
All right, I think that is something that hasn't been investigated either nationally or internationally, and it really is about who is accountable. If a practitioner utilizes a set of data to make a decision around a patient's treatment going forward, And that data is incorrect in some way, shape, or form. And we've got to remember that data is taken from everywhere. We're also finding there's amazing research, especially in the social sphere, where data that is incorrect is showing incredible bias when it comes to who gets treatment, what kind of treatment they get given, and there are very important demographic markers that we need to pay attention to when it comes to things like that. So who's going to take responsibility if a doctor uses AI for diagnostic purposes, makes a decision, treats the patient, and the data was incorrect, and there's a lethal outcome? And that is something that we need to look at, because we have no legislation that covers that. We've got no legal precedents that cover that, and we're going to start having that, because as AI becomes more and more utilized in the healthcare space, and I can share this with Dr. Singh, the reality is in South Africa it's probably not going to happen that quickly, so we can wait for everybody else to have the experience first. The bottom line is, who is going to pick up the legislative issues? Is it going to be the developer? Is it going to be the doctor who made an absolutely genuine diagnosis based on what he thought was correct information? So how are we going to do this? And it opens a whole lot of legislative nightmares.
And how do we even begin to clarify that? As you've mentioned, that AI takes information that we give it, and we're not always correct. How do we even begin to clarify what can we take as a doctor to a patient?
Oh, you're really going to have to trust your developer. And I think that one of the things that we found is that a lot of the data that's being used in healthcare AI is very old data. We take a lot of, for example, radiology slides that are 30, 40, 50 years old, and these are all used for machine learning. What we've got to remember is that when we are taking very old data, there are a lot of things that can go wrong. There can be a lack of clarity, there can be a great number of things that mean that the information that we are feeding it is incorrect. And remember that AI isn't human. AI only learns what we give it. So it's as good as the input, garbage in, garbage out. And if we're giving it garbage, even if it is a small amount of garbage, that garbage can skew your diagnosis.
Sure. Dr. Singh, I want to ask you the same question, but perhaps let me phrase it differently. If an AI suggests withholding treatment from a patient just based on poor outcomes, predicted poor outcomes, how should doctors then balance that view within against their ethical duty to care for the patient?
Great question. I think the wonderful thing is that in medicine, we've got so much of amazing literature that is up to date. And so I'm sure most of you have seen ChatGPT-5's new launch. You're able to actually upload large sums of data to it and then start generating some responses. In South Africa, for example, the National Department of Health has published the standard treatment guidelines. So those standard treatment guidelines is basically a list of the common conditions that you as a medical practitioner or as a member of the healthcare sort of practitioners would be able to see in a hospital setting. And it clearly defines all of the management processes as well as step-by-step treatment processes in terms of if a patient is maybe allergic to a cephalosporin drug, they could be given an alternative, etc. You were speaking about a patient that maybe has a poor outcome, poor prognosis, and now you want to withhold treatment so you can save it possibly for another one. Again, that all comes to the judgment of the attending doctor that's responsible for that patient. And I like to think of it like this: why can't we think of AI as another medical device? When we created in Alpha and Omega MedTech the rapid test for COVID, it's just another medical device to speed up diagnosis. So instead of taking blood and waiting for 1 hour with the National Laboratory Service to get a PCR result, whether you're tested positive for COVID, in 10 minutes you'll be able to know whether you have been tested positive. So again, that's supposed to help you to create a diagnosis, but the medical practitioner who has gone through 10 years of training is still responsible for that recommendation at the bottom, and it's your signature and your stamp that would be liable at the end of the day. So I think let's think of it as an augmentation tool to stop the guesswork, basically. How can we stop the guesswork, and how can we get sort of more specialized and up-to-date knowledge into it? As Dr. Gale said, we need to manufacture our own data, and we can't do that without systems not being digitized. So I think, again, for the patient that has a poor outcome, again, let's look at other patients who have had poor outcomes and their list of comorbidities, their age, their index, their current vital signs. Can they possibly make it, or can't they? I think, again, the attending medical doctor and their team, the holistic team. Again, it's not just a doctor. In an average hospital, you've got your allied health team, your psychologist, your dietitian, your occupational therapist, your physiotherapist. Their inputs are all needed, you know. And for a patient that has a poor outcome, they also need to be regularly checked by their physio, because possibly they're bedridden. So that also adds to the you know, the pool of things that you have to look at. Yeah.
And when we think about some of the countries that are doing this well, I know China is one of them, and they have their goals to become an AI leader, and especially in healthcare by 2030. Can we take some examples from countries that are already successful in their AI integration in this industry?
Excellent. So I would say, in my experience, now it's coming on 15 years with China, I had the pleasure of joining the Tsinghua University Vanke School of Public Health, where our professor, who is in charge of Healthy China, the Healthy China Policy 2030, again, their model of diagnostics, Palesa, is let's first do a barrage of tests, overall baseline tests, every single year for every single patient that is connected to that hospital. Now, once I've got that data, I can clearly define that this patient has already a propensity for cardiovascular disease because of their family history and because of their social history. Maybe they're a chronic smoker, or they're a binge alcohol drinker. We can't judge them, but that's the patient history, and so you'll be able to help them. So again, there are models that are using it, but the infrastructure is there. They've got hospitals in every single, county, and unfortunately, we're not yet there. We're still fighting NHI, and we're still trying to see is it right to do this? Is it not right to do this? We're still in the sort of argumentative phase. We're not in a phase where we understand how much it costs to actually do a barrage of diagnostic tests and actually roll that out at scale. So I think that's where opportunities lie. And there's many other countries that are doing that, but I would say in Asia, they are definitely ahead. In China, in India, and South Korea, for example, their diagnostics are just amazing. And the cost of the diagnostics are also far less than us. Imagine we're spending 130 billion rands to capacitate the district hospitals across the country. But in private, you could possibly capacitate more or see more patients during that. So I think efficiency outcomes also need to improve. Yeah.
Sure. Dr. I'm told I don't have enough time, but I want to come to you and pick your brain, knowing that I want you to speak from your vantage point from a mental health support. I'll make an example with myself. Sometimes I do talk to ChatGPT about my emotional problems, but could there be a role in AI improving psychosocial support, or is this a inherently human domain?
I think that it's got a very big role to play, because often we need to bounce something off somebody else. And AI is awesome for that. I mean, I talk to ChatGPT every morning, and we fight continuously. Just really because it really isn't up to my standard quite yet. We'll get there. But it's good to be able to bounce, and it's also good to be able to get hints and tips. Are you sleeping properly? What kind of things can you do to make your sleep pattern better? Do you stop drinking coffee at 9 o'clock? All of those it will give you. However, there will always be a place for another human to be able to connect with you. And as Dr. Singh said, the reality is that we need to understand that the practitioner is the final line when it comes to really prescribing, admitting you to hospital. ChatGPT hasn't got that right yet. But to be able to actually take control of a situation that's really complicated.
Okay. I have about 2 minutes left, and I would like to open the floor now for any questions, comments, anything. Please, can I see a show of hands? There should be a mic that is floating around. I think, you can go. I'm not sure if the mic will make it on time, but I think it'll be audible from where you are. Yeah.
So Thanks. Should I stand? Or?
Please.
Okay. So when you look into the current South African context and we look at people who have access to devices, we find that a lot of people don't have access to smart devices. And when we are now delving into this era of artificial intelligence and we're looking into the rural communities, I think we often negating the potential benefits that can be incorporated by harnessing USSD for mobile devices, because they also have the capacity for API integration, which can be tied to AI systems, so that people who don't have access to smart devices, they can also use maybe those 100 Rand phones to interact with AI. Maybe they can also have regular checkups using USSD technology, but it's just a matter of making it affordable. Maybe partnering with companies like Telkom to make it accessible. Maybe it can be free so that we can get these data sets that we are needing. So it can be a simple question, like 1, 2, 3, a series of options. How are you feeling today? Do you have any issues? And then all of that data gets processed by the artificial intelligence system. And yeah, I just wanted to pose that question because you guys are experts in your field, and I don't know if the idea is too ambitious or not.
Who's going?
Yes, thank you so much, sir, for your question. I think you're correct. In rural areas where private doesn't want to go, public is only there, right? So there's only public centers, and firstly, we don't have internet connectivity on average, right? So there's no fiber, there's no hard connectivity. You'll be blessed if you have an LTE connection. So I think those are the first barriers, that you have to go through. Access to smartphones as well is another issue. But yeah, I know a lot of companies like Intel. I remember that we worked with them on an edge technology, which basically would bring a mobile network to transfer the data that you had in a packet and then send it out to a sort of centralized system so that it could be reviewed and a response could be given back in the same packet. So I think, again, as the technology develops, you'll be able to have those outcomes. But again, those conversations need to happen, and they need to happen at scale. If it's only happening in one small community and nobody knows about it, then it's not really accessible. It's not going to solve much of an issue. Yeah.
Okay. Thank you to my distinguished panelists.